Hi, my name is Namrata Sharma. I'm the project curator at Assam State Museum. Firstly, I would like to congratulate everyone on the occasion of International Museums Day 2020. And today I'm going to talk about one of the aspects of the changing role of museums in the 21st century, which is health and well-being in museums. So we know that Assam State Museum is one of the leading cultural institutions in Northeast India in the field of managing local, tangible and intangible heritage. Nowadays, we see that the scope of cultural institutions have expanded much beyond their primary focus, which is culture and heritage. And museums have moved their resources and expertise towards responsible and inclusive social commitments. So with that novel vision, we as a museum have actually collaborated with OncoCare to conduct awareness programs for cancer survivors and patients and for healthcare providers and the general public. So the OncoCare is actually a Guwahati-based trust assisting individuals with cancer, and the museum is actually one of the first government institutions in Northeast India collaborating with medical professionals to develop a support mechanism for those bravely fighting cancer. So we know that cancer is one of the most serious diseases that may affect an individual. An immense amount of bravery, inner strength and resilience is actually required to fight it. For this reason, the patients need a very strong support network consisting of family, friends and also society. And based on trust and compassion, different groups of society must join hands to facilitate an empowering environment for cancer survivors and those fighting against the disease. So, in collaboration with OncoCare, Assam State Museum has actually come forward to nurture such an environment. And throughout my professional career, I have come across various museums practices from many museums across the globe. And in the 21st century, the museum's actually gaze has undergone a paradigm shift. And the focus of today's museum is no longer on lifeless objects, but on individuals and their place in society. Physical well-being, emotional well-being are one of the key aspects of the new museums in this increasingly turbulent world. So we find that a lot of Western museums have actually developed innovative strategies to engage with the public, and the core issue they have grappled with is loneliness and depression in the elderly. And during my visit to the Ulster Museum in Northern Ireland, while I was doing my training with the British Museum International Training Program, I have witnessed that how this issue was actually addressed by encouraging senior citizens to visit museums, interact with the art collection, and make new friends in the museum settings. And I was really fortunate enough that when I joined the Assam State Museum, I was eager to follow the best of these practices catering to the specific needs of the individuals and societies in Assam. And I was actually fortunate to be collaborating with this trust, OncoCare, and a special thanks to my director, Y.S. Wonglangton, for giving me this opportunity to be part of the program. And basically the primary focus of this project was to craft a safe space where individuals with cancer can engage in activities that will be beneficial for their emotional well-being as well as intellectual stimulation. And as a museum, actually we would provide our own space for museum-based support groups, art and craft-based therapy sessions, and also awareness programs for the patients. And besides that, we also have waived entrance fees for cancer patients. We do not really charge and give them free guided tours. A constructive exposure and dialogue with the collections of art and artifacts are actually expected to make a positive contribution to the well-being of the cancer patients, who often experience immense emotional stress and isolation. And on the premises of our museum, OncoCare has actually organized a series of events and art and music therapy sessions. There were also conversations and consultations by experienced medical professionals. Joydeep Purkayashta, he's the doctor and he's one of the leading members of the OncoCare Trust. And the outcome of this collaboration was actually overwhelmingly positive, and the project helped to build a unique network of cancer patients, healthcare providers, and also museum professionals. And it also gave hope not only to the patients but also to their caregivers. And through diverse activities, they were able to actually develop new emotional bonds and skills, and also create fresh memories. And these activities, based on an exploration of nature and art, were actually tailored to suit individuals and diverse age groups, genders, and cultural backgrounds. And actually, based on this encouraging results, we as a museum, and Assam State Museum being part of it, looks forward to devising further inclusive projects and making meaningful contributions to society. Thank you so much.